My name is Christina Rhodes. I'm going to be doing my head-to-toe assessment on my son, Brody. Okay, hi, my name is Christina. I'm going to be your nurse today. Can you tell me your name?
Brody Rhodes.
And your date of birth?
05/26 of 2010.
And then where we are located.
My house.
Okay. Are you in any pain on a scale from 0 to 10?
No.
Okay. And patient seems to be alert and oriented ×3, sitting comfortably, no signs of acute distress. Glasgow Coma scale +15, and 0 on the pain scale of 0 to 10. Okay, now we're gonna go to your skin. Do you have any issues with any lesions or moles that you're concerned about?
No.
Okay, I'm gonna palpate, which means I'm gonna be touching you. Is that okay?
Yes.
Okay. Warm and dry and intact skin, and then color is appropriate to your ethnicity. Now I'm going to look at your head. Do you have any issues with headaches or anything?
No.
Okay, I'm going to palpate. Let me know if you feel any tenderness. Okay. The head is normocephalic, atraumatic, and no signs of lesions or nits. Now I'm going to look at your facial expressions. Can you raise your eyebrows? And then can you puff your cheeks? Good. Facial is symmetric bilaterally. Now I'm going to look at your eyes. Actually, I'm going to look at your ears first. Do you have any issues with your hearing?
No.
Okay. I'm going to palpate your auricles. Let me know if you feel any tenderness. And your tragus. Okay, so no hearing loss or anything you're concerned about?
No.
Okay, perfect. Now I'm going to move to your eyes. I'm going to be doing 2 tests. Go ahead and look at my finger and then go where it goes, but do not move your neck, okay? Up, over, down, and down. Good. Now I'm going to be shining a light. It looks like your pupils are at a 3 millimeter. Go ahead and look straight at me. Perfect. Perfect. So pupils are equal, round, reactive to light, and accommodation. Any vision issues that you are concerned about?
No.
Okay, perfect. Now we're going to move to your neck. I'm going to palpate for your cervical lymph nodes. Any stiffness or any pain that you're concerned about?
No.
Okay. No lymphadenopathy noted. It looks like his trachea, can you look at me? Trachea is midline. I'm going to note the cervical pulse. Or I'm sorry, the carotid. Okay, now I'm going to auscultate. Perfect, no bruise noted. Okay, now I'm going to look at your nose. Do you have any issues with smelling or with breathing through your nose?
No.
Okay, go ahead and cover one nostril, breathe in and out, and the other. And nares are patent bilaterally. Now I'm going to look at your arms. Do you have any issues with your arms?
No.
Any pain or stiffness with movement?
No.
Okay. I'm going to note your pulses. So your radial is located here, and your brachial. And both pulses are noted. And then let's look at your capillary refill. Less than 3 seconds. Go ahead and do what I do. We're going to abduct, adduct, external, internal, okay? And then we are going to supinate, pronate, and then flex, extend, make a fist, moving side to side, and we're going to put our hands out and we're going to flex, extend, hyperextend. Good job. Now we're going to take our hands and we're going to abduct, adduct, and then we're going to, this is called palm reflection. Perfect. I think that's good for the arms. So now we are going to do the resistance. So go ahead and put your arms out. Nope, right here. And don't let me push or pull you. Good. Full range of motion and +5 for that, and full resistance has been met. Now I'm going to listen to your lungs. I'm going to listen to the second intercostal space. Take a deep breath. Okay, and then I'm going to come around. That was the anterior. Now I'm going to go posterior. Put your head down. C7 is noted. I'm going to do the upper, middle, lower, lower. All lung sites are clear to auscultation. Any issues with breathing that you're concerned about?
No.
Okay. Now I'm going to move to your heart, and I'm going to auscultate all anatomical sites, okay? Do you have any issues with heart disease in your family?
No.
Okay. So first we're going to listen to the aortic, which is in the second intercostal space, the pulmonic, again, second intercostal space, left side. Third intercostal space is Erb's point. Fourth is tricuspid. And fifth is mitral, which is also the apical pulse. During the assessment, I noted S1 and S2 sounds, and the rhythm and rate are regular. Now I'm going to assess your abdomen, so go ahead and lay down. Do you have any issues with bowels that you're concerned about?
No.
Okay, I'm going to auscultate all 4 quadrants and listen for bowel sounds. I'm listening for 5 to 20 within a minute in all 4. Any less would be hypo, any more would be hyper, and I would listen for longer. So we've got the left lower quadrant, the right lower quadrant, right upper quadrant, and left upper quadrant. Okay, bowel sounds were noted. Now I'm going to palpate lightly and then deeply. Let me know if you notice any tenderness. Good job. Any issues with that?
No.
Okay, go ahead and sit up. Okay, now I'm going to go to your legs. Do you have any issues with tingling or tenderness?
No.
Okay, I'm going to note your 3 pulses. So popliteal is going to be behind the knee. Posterior tibial is right above the ankle, right here. And then dorsal pedialis is right by the big toe, right in here. All pulses were noted. Now I'm going to look at your legs for edema or tenderness. Let me know if you feel anything tender. No edema noted. No change in coloration. It's appropriate to his ethnicity. And